I remember thinking that dialysis would completely dominate my life, and that once I started doing dialysis, my life would change from living life to just surviving. And living just to survive felt like a complete loss of freedom, a loss of opportunity, and was depressing. And I didn't want to live my life like that. So I learned everything I could about what my life would look like once I started dialysis. Now, I only knew of one way to do dialysis, and that was hemodialysis in the center. And so I knew you would go in and they take your blood and it'd go through a machine and it would put it back in and you would go home. But as I was doing my research, I learned that there are different forms of dialysis and different methods in which to do dialysis. And I remember thinking, what? There's options, there's choices. And that kind of threw me out of this depressing funk, because I could focus my energy and my time on researching what form of dialysis would work best for me. I'm going to go over the different methods and different forms of dialysis to help you start your own research on what form of dialysis will work best for you. There are two methods of doing dialysis. The first one is the more popular one, and that's hemodialysis. And that's when they actually remove the blood from your body. It goes into a machine to clean it, and then they return it back into your body. The second method is peritoneal dialysis, and that's when they fill your peritoneal cavity with fluid, and that special fluid is what draws out the toxins and the extra water from your body. In hemodialysis, an artificial kidney machine called a dialyzer is used to clean your blood and remove the extra toxins, extra fluid, and extra waste from your blood. For your blood to be able to leave your body and go into a machine, a doctor is going to need to make a vascular access into your blood vessels. This is done by having a surgery on your arm, on your leg, or on your neck. If you choose to do hemodialysis, there are 3 different surgeries that you can get to access your blood. The first option is to get a catheter. A catheter is when they take a small, soft plastic tube and put it into a large vein, usually on your chest or your neck. Usually a catheter is used if you need to start dialysis right away, but it can be used long term. The second choice is to get a fistula. So how they do that is that under the skin, usually on your arm or your leg, they will take a vein and an artery and they will put them together and create a larger blood vessel, and that's called a fistula. And a fistula is the first choice for doing dialysis because it generally lasts longer and has fewer complications like getting an infection or clotting. Now, not everybody's going to be able to do a fistula, because sometimes somebody's veins and arteries are not strong enough to be able to be sewn together. So the third option is to get a graft. A graft is when the doctor will connect your vein to your artery using a soft plastic tube. And this is considered the second choice for getting access to your blood for dialysis. When doing dialysis, if you have a fistula or graft, your hemodialysis technician or nurse will place 2 needles into that access point. Those needles are attached to rubber tubing. One of them will lead to the machine for your blood to be cleaned. The other will return the blood to you. Now, usually hemodialysis is done in center. That's the most popular way. And often it will be 3 times a week and you'll go in for 3 to 4 hours. Now, usually when you have in-center, you have a set schedule and time when you come in and do dialysis. You are not responsible for doing dialysis yourself, and they'll have all the supplies that is needed to do dialysis. There are other ways of doing hemodialysis besides just in-center. There is also self-care hemodialysis, and that's when you're able to go in the center, but you are going to perform hemodialysis on yourself. And the nurses and technicians are there just to support you. You can also do hemodialysis at home. That means that you're responsible for doing your own hemodialysis and that you get to be able to set your own schedule of when you want to do dialysis. There are 3 types of hemodialysis that can be performed at home. Now, each of these are going to take a couple to about a month's worth of training before you're able to do hemodialysis on your own at home. The first one is conventional home hemodialysis, and this one mirrors what you would do in center. So you do dialysis at least 3 times a week for 3 to 4 hours. And again, you're the one going to be performing dialysis, and you're also going to be trained on how to deal with any problems that might arise. The second method is short daily home hemodialysis. And this is when you will do dialysis 5 to 7 days a week, but therapy will only last about 2 hours. And because this is done more often, then usually less fluid is pulled off of your body, and that can lessen some of the side effects from having to do hemodialysis, like headaches, nausea, or feeling like wiped out at the end of therapy. The third way of doing hemodialysis at home is nocturnal home dialysis. And this is when you do hemodialysis through the night. So these therapy sessions last longer. These are going to be 6 to 8 hours long. And the longer your therapy lasts, the more fluids and toxins will be removed from your blood. It is also possible to combine daily and nocturnal hemodialysis. That all depends on what your body needs and what you want your schedule to look like. The second type of dialysis is peritoneal dialysis. Now, in peritoneal dialysis, your blood does not leave your body. Instead, fluid is put into your peritoneal cavity, and your peritoneal membrane is used as a filter, and that fluid draws out the extra water and toxins from your blood. Now, you will need a catheter placed to get into your peritoneal cavity. That catheter exit site can be on your chest, on your upper abdomen, or your lower abdomen. There are 2 methods of doing peritoneal dialysis. The first one is continuous ambulatory peritoneal dialysis, CAPD, and the other one is continuous cycling peritoneal dialysis, CCPD. It will take a week's worth of training to be able to do peritoneal dialysis on your own. Now, I have another video that goes into more detail comparing these 2 methods of peritoneal dialysis, because this is the form of dialysis that I chose. Now, CAPD is the only form of dialysis that is done without a machine. This type of therapy is done during the day, every day. And what you do is you use gravity to fill up your peritoneal cavity using that catheter, and that membrane will then begin to filter out the extra fluid and toxins from your body. And that fluid will stay in your peritoneal cavity for about 4 to 5 hours. And while they call it dwell time, and while it's dwelling, you're able to move about and do whatever you want through the day. And then that fluid, again using gravity, will be drained out of your peritoneal cavity, and you will put in new clean solution. So you'll need to do 4 of those exchanges every day. Now, CCPD, continuous cycling peritoneal dialysis, is when you perform therapy using a machine called the cycler. And therapy happens overnight while you sleep. For me, therapy from beginning to end lasted 8 hours. And just like we talked about before with the exchanges, these exchanges happen quicker. So the fluid dwells in your peritoneal cavity for about an hour and a half before it's drained and refilled. And you don't have to do anything while you sleep. You turn on the machine and it will do all the filling and draining for you. Both forms of peritoneal dialysis are interchangeable. And when you get trained to be able to do either one. And that allows you to have flexibility if your schedule changes or if you decide to take a trip. I hope this video helped you in seeing that there's a lot of choices and decisions you can make trying to decide what type and what form of dialysis will work best for you. Please be proactive as you decide which one will work best for you. You may not have as many options available to you as I did, but please don't leave your decision of what type of dialysis you want to do solely on somebody else, even your doctor. You need to make sure that you talk with those that are helping and supporting you, your doctor or healthcare provider, and work together to figure out what will work best for you. If you let other people make important decisions for you, like choosing which form of dialysis to do, it will leave you feeling like a victim of your circumstance and that you don't have control over your life. When in reality, you are someone who is stronger than you think, and you can overcome this hardship. Thanks for watching.